Welcome everyone. Thank you for joining the NAS Provider Video Series. This series of 4 videos was developed to increase awareness and understanding of adverse childhood experiences, prenatal substance exposure, medication-assisted treatment, and the impact on infants and their families. The development of this public education series is the result of collaboration between state agencies and community partners. This video explores the support for families impacted by neonatal abstinence syndrome and opioid use disorder, and is presented by Janae Sissenroy, Arizona Early Intervention Program Administrator and Part C Coordinator. A coordinated and compassionate approach is needed to respond to the needs of infants and their families impacted by opioid use disorder. This program explores the impact of support services available to eligible infants and toddlers through the Arizona Early Intervention Program at the Department of Economic Security.
Opioids are threatening the health of pregnant women and their babies in both rural and urban communities across America. In June 2016, Arizona's Governor Doug Ducey declared a statewide health emergency to address the opioid epidemic. This declaration allows agencies to work together to respond to the growing public health epidemic and ensure that there is a coordinated and comprehensive system that is in place to respond to the babies that are born to the opioid use epidemic. According to the U.S. Surgeon General's 2016 report, Facing Addiction in America, addiction is a chronic neurological disorder and should be treated like any other chronic disease. It is important to respond to this epidemic with a continuum of supports and services, which begin with prevention in the early childhood years and building resilience within the family unit. These comprehensive services must also focus on strengthening parenting skills and include evidence-based treatment approaches for those struggling with addiction. This comprehensive and systemic approach must ensure that the system of supports and services provided to a child with neonatal abstinence syndrome and their family is evidence-based and individualized in order for the outcomes to be successful. Pregnant women with opioid use disorder are at a higher likelihood to not receive prenatal care during their pregnancy. They also may have difficulty keeping appointments or only seek care later in their pregnancy. This puts the developing baby at a much higher risk of a host of complications. Pregnant women with opioid use disorder may not have access to nourishing foods and vitamins that help promote a healthy pregnancy, healthy weight gain, and a healthy baby. More than 35% of women with opioid use disorder during pregnancy also screen positive for additional drugs, such as marijuana, cocaine, or benzodiazepines. Additionally, they may also be at a higher risk of having co-occurring mental health challenges, including depression, anxiety, mood disorders, bipolar disorder, personality disorders, post-traumatic stress disorder, or eating disorders. There may also be a history of victimization related to physical and sexual violence, and the mother may also be dealing with adverse childhood experiences. The use of opioids, compounded with the lack of prenatal care and lack of treatment for these other challenges, can result in a host of health complications for the pregnant woman. Neonatal abstinence syndrome, NAS, and neonatal opioid withdrawal syndrome, NOWS. These terms are often used interchangeably. NAS is a clinical diagnosis and a consequence of the abrupt discontinuation of chronic fetal exposure to the substances that were used or abused by the mother during pregnancy. NOWS is an expected and treatable condition following the maternal use of opioids during pregnancy, causing postnatal drug withdrawal. Statistics on opioid misuse and NAS during the last few years have elevated it to a public health epidemic. Babies with NOWS represent a subset of the larger issue of infants with prenatal exposure to substances. The opioid epidemic requires recognition that it is an addiction that requires a comprehensive and coordinated, and compassionate response to supporting the family with supports, resources, and treatment and recovery. Effective approaches to supporting women with opioid use disorder during pregnancy and parenting include evidence-based medication-assisted treatment and comprehensive services that address the needs of mothers, infants, caregivers, and families. Effective treatments for babies who are born exposed to opioids and who may experience withdrawal following delivery include appropriate referrals to agencies trained to support babies and families with neonatal abstinence syndrome, care coordination between all providers servicing children and families. This may include the medical, mental health, and developmental health providers, early intervention teams, and the home visiting programs, as well as the Department of Child Safety or any other programs that are assisting the child and family in coordinating care and supports. A role of supporting families is to really truly ensure that the professionals are trauma-informed and that they are providing relationship-based supports and services to each family that they serve. Trauma-informed care is a perspective through which an organization realizes the impact of trauma on its families, recognizes the signs of trauma, and uses that understanding to improve client engagement, outcomes, and organizational services. Arizona Early Intervention Program is in place for children birth to 3. In order to be eligible for services for Arizona Early Intervention Program, a child must be experiencing a significant developmental delay. A baby born with neonatal abstinence syndrome, they are automatically eligible for early intervention services. We provide team-based early intervention for the child and family. Team-based early intervention services means that a child has a team of professionals ready and able to support them with their child's development. That includes a physical therapist, occupational therapist, speech-language pathologist, developmental special instructionist, service coordinator, psychologist, and social worker. When a child is eligible for services birth to 3 in the state of Arizona, they also may be eligible for services under the Division of Developmental Disabilities. When an infant is diagnosed with neonatal abstinence syndrome, they are automatically eligible for early intervention services in Arizona. When this child is brought through the eligibility process, that child and family will then have an individualized family service plan. Those IFSP outcomes then can focus on the child and family. The IFSP's team's job is to collaborate and coordinate services across any resources and other agencies that are supporting that child and family. We have adopted 3 major components to create team-based early intervention services. One being primary coach teaming practices, which creates an approach that allows all team members to have the opportunity to share ideas, strategies, and coach other team members throughout the process of early intervention. Another being coaching practices, which really support families and other caregivers to increase their ability and knowledge to support their child throughout their development and growth. Another part of that paradigm is natural learning environment practices. We really recognize that children learn and develop and grow within their everyday routines and activities with those individuals that they interact with on a daily basis and in the settings which they spend most of their time. This is an evidence-based paradigm. When all 3 of these are effectively implemented, you shall see that participation from the family is optimal and the team has truly built that family's competency and capacity to care for their child with neonatal abstinence syndrome. Family-centered practices provides a foundation for strengthening relationships and engaging families. Family involvement needs to be judged as meaningful and worthwhile by the family in order to sustain parent engagement. Responsiveness to parents' informational, instrumental, and other types of needs is one factor contributing to parents' judgments of a meaningful involvement within supporting their child with neonatal abstinence syndrome. Self-efficacy appraisals are one determinant of the likelihood of parent involvement and engagement having positive parent and child benefits. When families are caring for babies who have been exposed to substances and specifically having challenges as severe as those present with neonatal abstinence syndrome, They oftentimes need additional encouragement and capacity building practices in order to build their competency and capacity to care for their child on their own. Additionally, the parent is likely to present with high stress and unique challenges, and it is important for their voice to be heard and valued, and for them to be empowered to make informed decisions and treated respectfully. Supporting families to identify resources requires more than just providing them a list of resources. All professionals who support families must be able to actively engage families in a process to identify potential resources and supports, and to assist families to determine how and when they would like to proceed with each identified resource. This is an opportunity to utilize reflective coaching questions as an adult learning strategy. Research shows that outcomes are higher and greater when the individual is supported to develop and commit to a meaningful goal, locate and finally use the resources to meet that goal, rather than depending on a third party to determine and set the parameters for the goal that was set for them. Within Arizona Early Intervention Program, we believe that our shared focus should be on empowering individuals and families to achieve their goals, not just in the present, but in the future as well. And we do this through the use of participatory help-giving practices. To do this effectively, we utilize evidence-based tools and train our service coordinators on this practice. In order to ensure a strengthened system of supports and services for a family who is caring for a child with neonatal abstinence syndrome, a system of formal and informal resources must be built around them. Gathering information from families about their informal and formal supports is essential to identify which supports can help families to achieve desired outcomes for their child and themselves and strengthen their system of supports. Informal resources are people who are a part of the family's personal social network and is generally more long-term and desired support system for the family. It is imperative that a family who is caring for an infant with neonatal abstinence syndrome has an informal support system with individuals that are healthy, reliable, and supportive. Formal resources are typically individuals from organizations or agencies that provide assistance to the family. Formal supports are typically shorter-term supports that are for the course of the program or until the need has been met. It is imperative that all the formal resources that are working together to support a child and family are doing so in a streamlined approach to not duplicate services, but instead complement the work of one another to ensure the outcomes of the family are being met. Within different areas of Arizona, the supports and services available to support a family varies. It is important to know the specific geographical boundaries of the families you serve, as the formal supports in that area may be limited or vary depending on that area. No one agency can solve the opioid epidemic. We need to work together as state agencies and community partners to ensure that we're leveraging the resources and supports that are out there and available to families that are affected by the opioid use disorder and by infants that are affected with neonatal abstinence syndrome.